Billion dollars. The highest leading cause of death from the ages of 15 to 30 is suicidality. Suicidality. We're going to talk about that. Suicidality. The killing of the self. Suicide. The self. Killing of the self. Suicide. Apart from that, the second leading cause of death among that age group is motor vehicle accidents. Even cancer doesn't kill people that much. And so diabetes doesn't even kill people that much. But mental health, 20% of patients will die. Why? The stigma, discrimination, neglect, prevent care treatments for reaching people with mental disorders. 2/3 of people, that is, of 1,000 patients, 2/3 of people, almost about 75% of them, will not come and speak about their illness or their problem because of the fear of being judged, the fear of being stigmatized. As a family of church, where do we begin? A place where there is no understanding, there is neglect, and vice versa. And so the young people, is the Spirit of God leading them to have this kind of conversation. Because it is real. Just like any other illness, it's real.
Can you move to the next slide, please? Daniel, the next slide.
There are so many. Idiopathic. In medicine, when we say idiopathic, it means we, as a healthcare providers, we have no clue. But we use the word idiopathic because it makes us feel good. Okay? So we have no clue. It's idiopathic. That means we have no clue. We have some ideas, but we don't have a definitive conversation to have with the families. Like, for instance, cancer is idiopathic, right? But with diabetes, we can safely say, especially type 2, most commonly, if it's genetic, the family has it, 25% chance, it doesn't mean you're going to have it. But even lifestyle can be, predisposing position for families and patients. Or sometimes even a simple stress. Stress. There was this which I was reading yesterday. It talks about when immigrants come into this country, the first 5 years, we have the best mental health evaluation. Do you know why I think that is? Because they will say, God has done so much for us. And it's like, wow, this is the Holy Land. This is so great. Now, I said, but I'll see, between the people who have issues mental health wise and those that live from 14 to 20 years now, or who have a lot of mental health problems. And I think because sometimes we get so sucked in the assimilation system that we actually begin to forget some of our cultural things. And then realistically, some of the struggles that comes with our families, like, our parents, right? Like, the well-educated parents who was having a very nice job back home, doesn't have any job right now, driving the Uber, the Uber, whatever you call it, or, even the one that was selling the cassava, she had the freedom, right? Or stress. I had also the also sorry no any kind of young people, some of the bullying, the horizontal violence that they experience at work, I don't even know how you guys have done. Let me shrum. Yeah, you guys have done well. Let's go back to learning. Sorry. So causes, idiopathic. We talk about stress. It's just stress though, because that is what is killing us. Stress. Genetics, only 25%. It's not definite. In fact, it's Sibi. Ghana for. And so be struggle with a year and still don't think Korea will be better because of that. So it will be very unfair. Right? I know the culture I come from. And so when I'm having this kind of teaching, I have no boundaries because I know I'm home. Right? And I say the same things to other people as well too. It's no say you were depression and say, oh, don't because of your money now, that's not right. That's not right. That's why I'm very, very sensitive about those things, right? Infection, like encephalitis. Like some young person that gets a common cold, or even the adult that gets a common cold. It could be a common cold. that gets untreated. And some of these viruses can lead us to have encephalitis, or it could be bacterial infection, like meningitis, right? Somebody got meningitis, or whatever the case is, they had flu-like symptoms, they never went to the hospital. And then now the bacteria has shrunk to their brain. So the meninges of the spine is now infected, and their brain is fried, and they're now in vegetative states, right? And so all of these things, neurotransmitter imbalances, the chemicals, the biochemicals that work within our brain. Specifically, the common one is dopamine. When it's low, it can definitely cause a problem for us. But the good news is that I did be used to be a free social factors, change of environment for for our parents, and even for us too. When our parents are trying to raise us the other way, like they know best, but we are having struggles because of lack of cultural understanding or appreciation sometimes. So sometimes it's not just the parents that have issues. Sometimes we also need to tune down and ask ourselves, what is it that we're missing? Right? Your culture is not a negative thing. It's something for you to be very proud of. But sometimes we think it's barbaric, and that becomes a problem. So have a safe conversation with the parents. Okay? They are not really outdated. The basic things they need to tell you is there. So even when you think you know it all, just tone down and have a listen. Classification of mental disorders. So we talk about the mood disorders, and the mood disorders, example of them is the depression, anxiety. You can depression, just have a thinking about it. We'll ask these questions at the end, but I want you to start thinking about it. And oh, by the way, before I talk about this, you cannot, and I repeat humbly, you cannot go and diagnose somebody with having a mental illness or disorders until they have exhibited that behavior consistently 7 days a week for 3 months straight. Okay, so if somebody's naturally having, a very bad day and they're feeling quite down, it doesn't make them depressed. They can have low mood symptoms, but it doesn't make them depressed. Or otherwise, a female who's having a physiological appropriate biochemical changes during their menstrual time and their PMSN, premenstrual symptoms, and they appear a bit, maybe passively aggressive. Yeah, passively aggressive, sometimes even full-blown aggressive, right? It's biochemical. You've got to teach these things, right? And in your face, it's not because they have some sort of issue, but so consider the circumstance. So once again, they have to have this problem constantly for 3 months before you can even think about having to label that. Anxiety, post-traumatic stress disorder, bipolar, low mood and high mood. Bipolar can come in different forms. So let's give a classic example. It would be someone who just want, consistent behavior. Only they say, a burning one. What's me fund the bank card? So what you had the rent? Won't you have the rent? On your shade, go and spend shopping spree. Spend thousands of dollars. I'm talking about thousands of dollars. Consistent behavior. Or best spending on Kaisa, won't you have the rent? Won't you have shade on your shade? And so euphoric, elated. The emotions is so high. It's so hard to bring it down at that time. But they do really irrational things that. And you said you'll be shopping out of range, doesn't make them bipolar. No, I'm talking about consistent behavior. That is actually causing an interference. So they are creating all of these debts, but they don't see anything wrong with it. Right? The other one could be, the bipolar could be somebody with a very high sexual drive. It's okay as well too, but they just sleep around with people. Right? I got patients they don't even care, no boundaries. When they're in that state, you just sleep around. I just want to go back to biblical things. I was reading the scriptures and it talks about how one of the miracles that Jesus had when he was with Peter. I think it was Peter's wife, whose mother had fever, and I think he had gone there to heal, make that miracle at home with Peter's mother-in-law. There is something about the God we serve. And that is why I believe in the last 15 years of working that some of these great healthcare providers, whether it be nurses, amazing nurses, some of them are just amazing, or physicians or nurse practitioners or physiotherapists, those that are spiritually inclined, you could see the magical work of God in their hands. Right? We are spirit beings. So, just to sway your mind from when you were thinking, say it was satanic and demonic, so can a physical illness be. Because even fever, or say, it went away. The spirits went away. It's no, let's go back. Schizophrenia is one of the most leading cause of mental disability in this country. 1% of people. So that would mean that of every 100 people, one of them would have some sort of schizophrenia. And you have some of these factors, like that's patients, right? That 32-year-old doing 30-year residency, all of a sudden, just out of whack, right? I'm going to get down to the bottom of it. I will say, yeah, I will follow. A dream be our friend person. A dream be important for God. Like this kind of classism in the way we approach professions, it needs to stop. Right? Every job that we do, it should be a calling. It should never be money driven. Because if it is, you will exhaust yourself very, very prematurely. And you will never be happy. But I find it to be an insult to God when we begin to think, say, some jobs are better than others. Because some of these things are driving some of the patients to be sane. Right? Some of these things are chronically suicidal. If not for you bringing them to church, they would have done something really, really bad. You don't have to be a nurse. You don't have to be a doctor. You don't have to be a nurse practitioner. You don't have to be a teacher. You don't have to be any of those things. Do what you are capable of doing that will sustain you in this country. Plumbers make the same money that I do. Plumbers, almost 2 toilets minimum. They make the exact same money that I do. 75 an hour. It's a lot of money. Right? It's only one more friend. Because that kind of mentality is killing them. Maybe it's not like they need children, but that's what I see in the office. Because that doctor, the grandfather was a doctor, the father was a doctor, now the boy, they want him to be a doctor. He doesn't want to become a doctor. And now the boy is chronically depressed. Well, attempted suicide maybe 3 times. Why? We really need to shift our thinking. Psychotic disorders. So I just want to say, Sebi, some of the, even physical illnesses, some of them it may have sometimes active psychosis. Psychosis is not permanent. Or we are one for like let's say the 84-year-old patients that you go and prescribe them the morphine, and you gave them a bit of too much morphine and become delirious, right? And they're acting all out of range. It's not because something is really wrong here organically, but because pharmacologically it's been induced. Or otherwise, sometimes you may have some of these medications that you may give to patients, and unfortunately, maybe sometimes they have unpleasant side effects, being active psychosis. If it's really active psychosis, we can reverse that. Because once you take away the stimulus, I didn't know it will make the person come back to baseline. Dissociative disorders. This person was so lovely. And all of a sudden it's like, they're so out of range. That comes with even personality type of issues as well. So I don't want to go through much of that. Addiction. It doesn't have to be only, it's not just alcohol. It's not just tobacco. Sexual addiction. I just want to emphasize this for our Christian youth. God has ordained your physical bodies as His temple to make sure that He will give you that time to enjoy and have the best pleasure of that temple when you are age appropriate. However, when you invite the enemy into your bedroom, in your own space, and you begin to watch inappropriate, i.e. being inappropriate adult things, and you begin to give yourself self-pleasure, you may continue with that. And the problem is, most times, when you get married, even when you have a beautiful, beautiful, beautiful woman, because beauty is not physical, I'm talking about the physical, the inside. You have a beautiful woman, and she's giving you everything, but you're never satisfied. And you find yourself going around like a chicken with a head cut off, hopping from one place to the other. This one, I'm going to just say plain blank, you better go on your knees and pray. Because I don't know what kind of medication we're going to give you to slow that down by God. So some of these things, young people, it can begin very small and it becomes an obsessional thing. In the classroom, you can't wait to go home because you're going to go and do your other thing. Just be mindful of those things. Addiction, something that you were not born with, but you've allowed yourself to be doing that behavior so long that you can't get yourself out of it. You don't have to smoke cigarettes. That is why we call it addiction. Because in the absence of that, you can still survive. ADHD, autism, Papa mentioned that. Those are the developmental stuff. ADHD, autism, phobia, and dementia. Okay? Feeding and eating disorders. Eating disorders, I think is creeping up among Ghanaians. You don't even know it. The obsession with weight loss. Let me tell you something right now. When we call dieting, just remember diet. It's a diet with a T. Dieting kills. 20% of children in this country die because of eating disorders. 20%, that means 1 out of every 5 child will die in this country right now, as I'm talking to you, because of eating disorders. Being otherwise, having age-appropriate weights, or in our country, like where we come from, it's a sign of beauty. That's not even killed. The complication that comes with is very minimal compared to what they tell you. So this free of all this obsessional weight loss, and the kids are all getting so much into it, be very, very careful. Okay? It comes with a lot of complications. Sleep-wake disorders. Then diabetes, insomnia. Elimination disorders. Or people must sleep already even like 15 or maybe even 20, and they still have enuresis, nighttime bedwetting. And sometimes it's not because maybe on blood and there's a problem there organically. Maybe it's patent, there's no obstruction, maybe any hormone, but and sometimes it's here a little bit of blood training with counseling. In childhood, maybe they were inappropriately touched. Parents, I was talking about spiritual parenting. We need to spend time with our children. If you hear some of the things that I hear, I'm telling you, those babysitting stuff, as much as it's great, you don't know what spirit your child is exposed to. You need to make time. Sexual dysfunctions. I think a few months ago, I did a presentation for the women about those things. And it's not just, female. It could be female and both males. And we classify all of them as mental disorders. Not because they are people kind, but if you can't have pleasure. A young person was saying to me today, it's like, even in our Seventh-day Adventist culture, why do we see pleasure as sin? I said, oh, really? Then I have a hard time, because God actually made that the first time when He made Adam and Eve. He knew the importance of that. Personality disorders. The personality disorders, it's not all negative. Obi Ohonoma, for instance, they are very perfectionistic people. I think that's what most of us are who work in healthcare. Very perfectionistic. It's a trait. We don't have that disorder, but we have the trait. But when it becomes only a disorder, when it begins to interfere with your functional way of doing things, to the point that I got to get this 99% of that test. If I don't get it, I'm really done. No, you're not. Right? Or I have to marry by 25, and no matter that kind of rigidity. Having ambitions to have these things is not a bad thing. Like for instance, we have to be perfectionistic to work in healthcare, because if not, you can just come in, they can slip anything on you and just say go. Even ADHD is not a negative thing, because an ADHD medical doctor works best in the emergency room, and they work best in ICU. You know that. I don't want that doctor who is so perfectionistic to come to me when I'm having a heart attack and go, this is the lead one, And then they too. I want somebody who's going to say, slip it off. So, and you be and so bad. Because, yeah, you know, one Magana, we but they become the police officers. Because we normalize everything so much. Right? It's maybe I do not say, no, as a woman, Muslim, be what may say, they don't see a day I just come when they be conduct disorders. Obi was a before in any saw the crack. Sunday man, I will say bomb pie. Because Obi one, the kid actually has a problem because maybe they are being picked on a school. It's a conduct disorder will be Obi a one they will never follow through instructions at school. As a matter of fact, if you cry now or you won't change now. But you know, some of these things now, so you're very, very careful because Obi one. Ebe ya bone saa elu nti no so kuswa obi obehunu bia so yede ono so bono enti yakopɔ share passe o me yehu no say ye wonya so ye because some way na no yeti asia emboye enti me pom chewa e ka dwuru base bi ya krabone abofo nya krabone oh ade wo yi di mani so nka yi bi se akrepe because yakopɔ abodi bi no ebone enti ko sakare akabone I have a problem yakopɔ abodi bi no ebone but e bia na abofra no sebi eno ma muso fam no sana abofra no so fam no e bia ade bi wo no mo a akora no ohinya odo they need kindness, they need the presence, they need love. Gender dysphoria, I mean they never say we're in a place at least no. By the grace of God, He's made our, our identity quite clear to us. This is quite real. Actually, as a matter of fact, we have a whole program we have a whole clinic for this kind of young people, right? At seconds, right? Kids that are transitioning from being boys to girls, and from girls to boys, for that matter. I'm still very young at my job, so I'm not going to make more comments. I need my job to keep my channel going. You hear me? That's right. You have any questions? You can ask me later. You have to say my name. I'm very comfortable with it. So I'm not going to go there. But, some of these things, they should know. But, yeah. Right? We have to be very, very, very sensitive to some of these things. Mm-hmm. It's still on? Does it have to be on?
Can I ask a question? Edna? Yes, can I ask a question? Yeah.
Do you want to ask it at the end?
No, concerning the conduct disorder.
Conduct?
Yeah.
All right. Are you still running?
Coming this evening.
Yeah, do you mind?